back. This is Boomer Life on CISL 650.
Hey, and welcome back to the show. You're listening to CISL 650, and joining us in studio today, Dr. Sharnell Muir, Snore dentist in North Vancouver, near the Oasis Car Wash, and people who live on the North Shore know that quite well. What's the corner? What's the street name?
It's Bewick and Marine Drive. Mm-hmm. Yeah.
And if you want to find Dr. Muir, it's snoredentist.ca.
It is. And you can make an appointment right online. It's very easy. So before the break, we were talking about the appliances that you make, custom make a prescription to put in your mouth. And you mentioned that a lot of extended health benefits cover. Now, in your dentist days, when you would put in braces and things, you would have payments over time. Can you do that with these? We do some of it. Mm-hmm. We're limited in the fact that we do have upfront costs from the manufacturer.
Sure, because you've got to buy it from them.
Yeah, so I certainly can try and assist patients if they need payment plans, but I'm limited in what I can do with that. But do remember that coming in and talking to me and having a consultation and doing a home sleep study and all of those, there's no cost to that.
Oh, okay.
You can come in.
Why did you make that decision?
You know, I think it's most important that people find out what they have or if they need treatment. Like a lot of people will come in and say, I'm really, really tired, and we'll find out they really don't have any sleep disordered breathing. And, you know, we send a letter and the patient back to their physician and say, maybe a thyroid study would make sense. Maybe an iron study would make sense. You know, what is it that's possibly causing the fatigue? Sometimes I'll get sent fatigue patients, and maybe they're too much blue light screen. You know, they
just can't switch it off. Right?
They just, they're limiting how much melatonin their brain is making by exposure to their cell phone and their computer at night, and they're not allowing their brain to go into a good restful sleep. So
I would suspect with the generation coming up that spend all of their time on their screens.
Yeah.
That it's really tough.
It is. And, you know, one of the biggest challenges that we do have with especially the younger population is they sleep with their phones. And they're always checking them, and they'll tweet and they'll send out messages in the middle of the night. They'll wake up and first thing they do is check their phone. And that can be a real problem for the chemistry in your brain and sleep. It's really something we have to watch.
So you're the snore dentist.
Yes.
You deal with people that snore. Also, a big component of your practice is people who have some kind of sleep apnea.
Right.
Now, we hear, it's interesting because we hear so much about different things that have happened when it comes to medicine. And sleep apnea seems to have really bubbled up in the last 10 years in awareness. Is that just my imagination?
Oh, no. It's definitely become, we're much more aware of the role that sleep apnea is playing in people's health. We just never knew before. Mm-hmm. You know, we haven't really, it's quite a new science. It's quite a new kind of part of medicine is looking at how sleep is related to all the other medical concerns that we have. You know, often you'll go into your physician and they'll check you for the high blood pressure, or they'll check your cholesterol, or they'll check any number of things that they're looking for as measurements of health. And yet, for a long time, we didn't connect all those dots and say, oh, and by the way, how are you sleeping? Mm-hmm. And do you snore? And are you tired? And or is there any other reason that sleep apnea may be part of the reason that you're developing these other conditions?
And do you have a parent who suffers from sleep? Because my dad now sleeps with a CPAP machine, which is, I'm kind of getting to the CPAP for a reason, because I see that you have some statistics around the acceptance of the sleep apnea treatments, which are typically the CPAP machines and then the oral appliance. So explain what that technique does and how you differ.
Right. So the CPAP machine, so a continuous positive airway pressure machine, has been around since the early 80s. It was the original therapy for sleep apnea. Prior to that, you know, the real only treatment was tracheotomy. So, you know, once the CPAP came along, the biggest issue with CPAP is tolerance. People struggle wearing it.
Because it's a mask.
It's a mask. It's blowing air at you. They swallow the air. The air blows in their eyes. They take it off at night. It bothers their skin on their face.
And it's all the humidity inside,
and it can be, right? Like for some people, they do tolerate it. But it does. Its biggest challenge is tolerance. Now, it's effective because it's a forced therapy. It will just increase the air pressure until the airway stays open enough that you can breathe. So if you can tolerate it, it's effective. The problem is people don't tolerate it either right away. They're not even going to try it. They don't make it through the trial, or at the end of 1 year, they're not even wearing it.
But I also hear complaints that it's noisy. So the spouse has to listen to this machine whirring away all night, right?
That's right.
And the person wearing it makes noise.
Yes. Yeah, so all of those things, like as soon as they open the mouth, the air blows out of their mouth if they're wearing a nose mask, or if they take it off at night to go to the bathroom, they've got to take it off or disconnect the air and it's blowing while they're going to the bathroom. So there's lots of reasons like that. And that's not to say it isn't a good therapy. The therapy itself is a good therapy. It's just hard for people to deal with. The oral appliance is a great alternative for especially mild and moderate patients, and certainly is a great therapy for patients, even if they're severe, to get something in there so that we're helping them manage that airway.
And do people use them in conjunction?
Yes, I have some patients that wear both therapies at once, especially if they have a very severe sleep apnea where, say, for instance, their CPAP machine, they can't tolerate the pressure that it has to use.
So they can turn the pressure down?
They turn the pressure down and they wear the oral appliance at the same time. Or they have an oral appliance for the cabin or for travel, for those instances when they weren't taking their CPAP because it was just too much bother for them.
I see they have the mini ones now.
They do. Yeah. They're getting better and better, and they're getting quieter and quieter, and they're getting all sorts of advancements in them because of the demand for those to fit into the lifestyle.
So do you have a statistic that you can touch on about the tolerance level?
There's a lot of numbers out there.
Okay.
There's a lot of numbers out there, but on average, they say that about 50 to 70% of patients can't tolerate it at about anywhere within the first year. And some people won't even go and get testing. Like they won't go and get the testing done because they're afraid their only therapy option is the CPAP. Mm-hmm. Now, some patients that come to me in those circumstances, they've come to me for the testing because they're hoping the oral appliance will be a fit for them. But if, in fact, they're quite severe and they would medically benefit from a trial of CPAP, I do ask them to do the trial. And if they're intolerant, that's fine. They can come back to me. But it's all done in conjunction with their physician. Their physician really has to be the one on board that prescribes the therapy that's best for the patient as well.
How many physicians are aware that the Snore dentist exists?
Not as many as I'd like. Yeah. It's a real challenge that way because your physician can't prescribe a therapy for you they don't know if you can find, and they don't think may or may not be done properly, right? These patients need follow-up monitoring. They need to be checked on a regular basis. The current guidelines are that the patient is seen regularly over the first 3 to 6 months of therapy and then annually after that. And all of that's important. Whoever's doing the oral appliance for that patient must have the facility of being able to dispense level 3 sleep monitors, must be able to get that level 3 monitor interpreted by a physician, not just a respiratory therapist who looks at it and checks off the auto score. It really needs to be looked at closely. It is a medical condition if we're treating apnea, and it needs to be treated that way.
So what do people who have been on the CPAP treatment and have come over to the oral device, what's their reaction?
You know what? For a lot of them, it's wonderful. They don't feel restricted at night. A lot of patients will come in and say, you know what, I think my CPAP wakes me up more times than my apnea ever did. And now they're able to sleep undisturbed throughout the night.
And because this is custom fit to your mouth, once it's in your mouth, you kind of forget it's there, don't you?
Yeah, you do.
Have you tried one?
Oh, yeah, I wear one every night.
Oh, do you?
Yes.
You wouldn't start. Come on now.
You know, a lot of women start snoring after menopause.
Really?
Yeah. The female hormones are very protective of the airway. So as long as you can breed and carry on the species, breathing is a worthy thing.
Yes, need to look after
That's
kids.
right.
Yeah.
But once you do lose the protection of the female hormones and your in menopause and post-menopause, we have a high increased rate of snoring. Some studies say even a doubling in snoring rate in women. And we have an increase in sleep apnea. And some studies even say a 6 to 9-fold increase in sleep apnea in women. So there's a much higher rate of snoring and sleep apnea in women, menopause and post-menopause. Yeah.
More than men at the same age? Or
no, men just gradually increase over time, irrespective of, a lot of other things.
So you're saying it's
over time. For women,
multiple of from before menopause and after.
That's right.
Okay.
Yeah. Whereas men just gradually worsen as they age. And we all worsen as we age, period, because we lose muscle tone. But
I'm guessing this is affecting the majority of the population, the way you're describing it.
Yeah. And really, at this point, our biggest issue is that, in 20 to 40% of the population, there's some degree of sleep apnea. Mm-hmm. Well over 50% of the population snore. And yet probably 80 to maybe even 90% of them are undiagnosed.
Yes.
It's that it can't be me. It's not me. No one's ever told me. It's not a problem for me. I'm just fine. And yet you're taking 2 blood pressure medications and you're drinking 7 cups of coffee in the day. So, it might not be fine and it might be you. And if 80 to 90% of these patients walking around with apnea are not diagnosed, we need to get on it because it can have long-lasting health consequences. It'll shorten your life at a certain severity.
Well, on that cheery note.
Yes, I'm sorry to be the bearer of such bad news.
No, I think it's wonderful because, I know there are people listening who are ticking all the boxes. I mean, we've ticked the boxes for me.
Yeah.
And I have to have the sleep test. And so I promise you when I come back from my next trip, I will come and get it done.
Yeah. It's really important that people take an active role in their health. Mm-hmm. It's something they can simply do at no cost. Get the study done, have a look at it, see if it's playing a role in your overall health, and see if there's something that can be done for it.
And the best way to get in touch with you?
Is the website, which is snoredentist.ca, or call the office.
And you do travel to other parts of the lower mainland, so that's good to know. Well, it's been fascinating yet again. And our next time we get together, we're going to have an author on.
Yes, so we have a guest speaker in for our next show. He is an industry expert. He's also an author on the subject, and he's also a patient.
Oh, really? So he went down this road and
knows all about it.
All right. So we look forward to that. And if I don't see you beforehand, happy Valentine's.
Yes. Enjoy your Valentine's Day. Treat your wife well.
It's her birthday, too.
Oh, lovely.
Yeah, good for her. All right. That's all the time we have for today's show. I'm Zach Spencer. Thank you very much to Dr. Sharnell Muir, the Snore Dentist, snoredentist.ca. And we'll speak to you next time on CL 650.